This time, Chair calls Dr. Jennifer Shuford. Dr. Shuford, please state your name and position. Since this is an organizational meeting, you will be classified as neutral concerning your testimony.
Thank you, Chair Van Dever. I'm Dr. Jennifer Shuford. I'm Commissioner at the Texas Department of State Health Services. Thank you so much for inviting me here today to give you an update on what's going on with measles, especially in the Panhandle and South Plains region. I believe you have a handout in front of you, and I'll be going through those slides today. And I'll start with background. So, measles is highly contagious. It's probably the most contagious virus that we know of. It's spread by respiratory droplets, like flu or COVID is, but it's also spread by the airborne mechanism, much like tuberculosis, where measles can hang in the air like tuberculosis does, and it can hang in the air for hours. So we know that measles can stay up in the air for up to 2 hours and be contagious over that period of time and can infect people who enter into that airspace. Up to 9 out of 10 susceptible or unvaccinated people will become infected if they're exposed to that measles virus, so it's very contagious. The best protection that we know of against measles is the mumps, measles, rubella vaccine, or MMR. So this vaccine provides really long-lasting protection against all strains of measles. And the MMR vaccine has been in use in the United States for over 50 years. So it's got a long track record. I'm going to the next slide, which talks about measles symptoms. So with measles, once somebody gets infected, there is a fairly prolonged incubation period. It's about 10 to 12 days, and then they start to have symptoms. And those early symptoms include kind of a moderate fever, cough, runny nose, red eyes, and sore throat. So it starts to present like a respiratory illness. And then after a few days, those infected individuals will get a higher fever. It can go to 104 and 105, be really high. They'll start to get that rash that's classic for measles, where it starts usually up on the hairline and then travels down the body. It kind of is red and then turns red-brown. And as I mentioned, it takes about 10 to 12 days before any of those symptoms starts, and it takes about 14 days before that rash starts. People are infectious from 4 days before that rash starts to 4 days after that rash starts. So one of the reasons why we're so concerned about measles is that there are complications that come frequently with measles infections. So they can cause serious health complications, especially in children under the age of 5, and really in those that are under the age of 1, pregnant women, and people who are immunocompromised. And so when we look at all the people who get sick with measles, about 1 in 5 will need to go into the hospital. So about 20% will be hospitalized. About 5% will get the complication of pneumonia. And rarely measles, it's about maybe 1 in 1,000. Measles can cause swelling of the brain, encephalitis, and can cause long-term neurological complications from that. It can also cause death. About 1 to 3 in every 1,000 people who get measles will die. In addition, for pregnant women, it can cause pregnancy complications like premature birth and low birth weight. There's data that also shows it can cause miscarriage. So let me talk a little bit about specifically what's happening in Texas right now. On January 30th of this year, we announced 2 confirmed cases of measles in Gaines County. Earlier in January, 2 measles cases occurred in unvaccinated residents of Harris County. So y'all may have heard about those. Those were travel-related cases and didn't spread to anybody else. And so that is separate from the outbreak that we've got going on in Gaines County. And so the cases in Gaines County related to the outbreak I'm talking about started near the middle of January, but it was diagnosed and then announced at the end of January. So, and these were the first cases that were confirmed in Texas since 2023. Now, both of those initial Gaines County cases were hospitalized. And they recovered and then were released from the hospital. They were both in school-aged children. They were from Gaines County, but were hospitalized in Lubbock, since a lot of people do seek their health care in Lubbock. That's where these initial cases went as well. Since these initial cases, an outbreak has continued in the South Plains and Panhandle regions of the state. So DSHS has a regional office in Lubbock. We're continuing to support the South Plains and Panhandle communities in coordination with the South Plains Public Health Department and the Lubbock Public Health Department through our regional office and our central office here. We're actively monitoring the spread of the disease and preparing for potential future outbreak scenarios. And we're doing these plans in coordination with public health partners, like our local public health partners out there, as well as the Texas Division of Emergency Management. If you flip over to the next slide, it shows a map. And so this is the confirmed case count that we announced on Friday, and the counties of residence for those confirmed cases. Over on the left-hand side of that slide, you can see that we've shaded the counties where those folks come from. You can see that outbreak is happening. It's really centered around Gaines County and those surrounding counties, but we've also identified cases in other counties in that South Plains and Panhandle region. We currently, over the weekend, have had more confirmed cases, and so our case count is now at 158 rather than 146. The same 9 counties are still involved, though. That has not changed. If you go to the next slide, this shows the measles cases by age group. And what you can see is that highest bar there falls in that 5 to 17-year-old age range. And so most of the cases, I should say, of all the age groups, the most have been found in that 5 to 17-year-old age range. At first, it was most of our cases were in this 5 to 17-year-old age range. Since then, we've seen it moving into younger age groups. And so we're now having increases in that 1 to 4 year age group, as well as that infant age group of less than the age of 1. If you go to the next slide, this is just a breakdown of this particular outbreak, the hospitalizations that have been associated with it. So on the far left, it shows the age group. And you can see it's broken down into those, the infants, 0 to 6 months and 7 to 11 months, and then the 1 to 4-year-olds, the 5 to 17-year-olds, which is that school age range, and then older individuals or adults. And you can see the cases broken down by those that have been hospitalized, those who had needed admission to the intensive care unit, and those who sought care only in the emergency department and did not require admission. But what you can see is that there have been people going to the hospital that have had severe enough disease to go to the hospital, be admitted into the ICU. And most of this is occurring in Lubbock. If you go to the following slide, this shows our 2025 Texas measles outbreak response activities. And so I'll go through some of the activities that we have initiated and continue to support. So in that first group, it shows measles specimen collection sites. We know that getting specimen collection and getting those specimens to a lab is really important. We do a lot of the testing here at our public health lab in Austin. We want to make sure that happens quickly. And so we have set up 7-day-a-week specimen collection sites and 2 sites in this outbreak area. We also have 4 strike teams that can collect specimens. They can go out and collect specimens if that's more convenient for where we're noticing cases or suspect cases. For laboratory capacity, as I mentioned, most of those tests had been coming to our DSHS public health lab here in Austin, and we have a fairly quick turnaround. There is commercial labs that can do it. They just have a longer turnaround, and so we've been trying to direct a lot of them here. Because this outbreak is happening out in South Plains and the Panhandle, we have asked our laboratory response network partner. And so it's Texas Tech, who runs a public health lab out there, asked them to also stand up testing and have given them all the support and supplies that they need to do that. They should be standing that up this week for local testing to be done. We're also working with El Paso, Tarrant County, and Bexar County to bring up measles testing in their public health labs to make sure that we have got capacity all across the state to do this testing quickly. We've also increased our own capacity at our lab here in Austin to make sure that we can run them quickly when we do get specimens. On the next slide, you can see the title, Access to Vaccine for Individuals Who Want Them. So we know that this vaccine, MMR, is highly effective at preventing measles. After the first dose, it's about 93% effective. After the second dose, it's about 97% effective. And because of the effectiveness of that vaccine, the United States was able to declare measles eliminated in the year 2000. And so this vaccine, like I said, has a long track record as well. We've used it for over 50 years. And so we know that this is a primary component of outbreak control and preventing outbreaks across Texas. And so we have stood up vaccine clinics that are operating 7 days a week in sites there in the outbreak area. We've also been accessing vaccine resources from CDC in order to push out through our existing vaccine programs, so Adult Safety Net and Texas Vaccines for Children. We have specific outbreak vaccines that we can use in this outbreak area for people who don't fall in, vaccine providers who don't fall into one of those networks. In addition, we've purchased other vaccines for other circumstances. We just want to have vaccine available for whichever providers can give those vaccines, especially in that outbreak community. But now we have communities that have experienced exposure of these vaccine cases as well. Of these measles cases as well, and we want to make sure that we've got vaccine available when they need those anywhere across Texas. And so we do have 5 deployable vaccine strike teams that can also go outside of the clinics that we've established and get vaccines to places where they need it. Under that, there's access to post-exposure protection to prevent illness. And so if somebody gets exposed to measles, there's a couple of ways that we can try to prevent it. And so we can try to get them a vaccine within the first 72 hours. And that can sometimes prevent disease in them. If it doesn't prevent it, it can at least make it more mild. And so we try to get vaccine out as fast as possible if somebody's been exposed. If we don't hit that 72-hour window, occasionally, we can also give immunoglobulin injections. And so this would be particularly for those babies who are under the age of 1 that are really susceptible to health complications. And so we are making sure that we have purchased more of this immunoglobulin and that we have positioned it out in the South Plains region so that we can prevent those really vulnerable Texans from getting sick. If you go to the next page, it talks about surge staffing to assist with specimen collection, epidemiology, and vaccination. So we have deployed a lot of our DSHS staff. So we've sent staff out to this outbreak area from our central office, as well as our other regional offices across the state that aren't experiencing this type of outbreak, and made sure that our partners out in the South Plains region have resources. So our DSHS employees have been doing that. We also have 27 contractors that are beginning today there in this outbreak area to assist local public health departments. We've also requested resources from CDC, including physicians and epidemiologists, to help with case investigations and hospital exposures there in the South Plains region and in Lubbock. Furthermore, we are doing messaging to ensure that individuals know that there's a measles outbreak going on and that we've got vaccines available. And so we've done public awareness efforts to cover the Panhandle and South Plains region. That initial education will include billboards and social media messaging, and that has started this week. And CDC has been supporting us in that as well. And DSHS can expand education efforts to other regions across the state as well if it becomes necessary. On the next slide, I talk about awareness and education for providers, schools, and local health departments. So we have issued health alerts to ensure that providers are aware of this outbreak. We're holding regular webinars through Texas Medical Association and Texas Pediatric Society. We're working with the Texas Hospital Association and Torch for those rural hospitals to make sure that people know what's going on and know that they can call on us if they have any questions or need any help. We're also working with school districts and local health departments. We're helping with hospital planning. We have done a call to hospitals across the state looking at their pediatric bed availability. We're starting hospital reporting this week using a platform called EM Resource, and so that we can look at those pediatric resources from across the state, including pediatric ICU beds, to make sure that we are prepared to take those patients if Lubbock becomes overwhelmed, that we know where we can transfer patients for that higher level care. And then we are, on that last slide, coordinating with appropriate state and federal agencies. So we've been working closely with Texas Division of Emergency Management, had multiple phone calls with Mike Morath of the Texas Education Association, and so working with TEA and TDEM. We have also been working with CDC and federal HHS and to see how they can best support us in these response efforts. If you go to the final slide in that packet, it shows kind of what our expectations are for this outbreak. So due to the number of suspect cases that we have right now, we do expect more confirmed cases to occur in this outbreak. We know of other outbreaks that have happened in the last 10 years across the United States have lasted months, some of them as short as like 2.5 months, but like the one in New York lasting about 10.5 months. And so that this could go on for a while until we are able to fully contain it. Some of the other expectations is that children who test positive for measles, as well as those who aren't vaccinated and get exposed to measles, are excluded from school due to the contagiousness of that disease. And so we are trying to work with TEA to try to minimize learning loss that happens there and loss of school funding. And then we are concerned about our MMR coverage across our state, knowing that it's lower than some other places across the United States, and that this particular region has lower vaccination rates, but that there's some areas in Texas that have very high vaccination rates, high enough to protect their communities. And so really watching that, but knowing we need to really be on the offense of offering those vaccines and getting education out so that parents can make those decisions to protect their family and their kids. And that concludes my presentation about measles, but I am happy to answer any other questions that y'all have.